All right, welcome back everyone to another episode of Integrative Wellness Radio. I have Shona here. Did I say that correctly?
You did, yes.
Okay, perfect. Well, I'm very excited to have our special guest here with us. She actually found us via Integrative Wellness Radio and sent us a really beautiful message and told us a little bit about herself. And I'm very excited to talk all about some of the amazing things that you're doing. But why don't you just tell us a little bit about yourself and what even attracted you to our podcast?
Okay, let's see. Well, I love podcasts. I
Okay.
listen to podcasts a lot. It's a great way, like if I take a walk, I like to listen to podcasts just to educate myself further, and especially about functional medicine and all things Lyme disease,
Mm-hmm.
because I got diagnosed with Lyme a year and a half ago or so. So, of course, I've wanted to learn as much as I could about how I can self treat. So that's how I found Integrative Wellness Radio. I think I don't remember who it was. It could have been Darren Ingalls. Did you interview him? He wrote the Lyme Solution.
I did not, no.
No? Okay. Well, somebody that I followed on Instagram was interviewed by you, and I don't remember who because it was a while ago. So I've
Okay.
listened to a few of your podcasts and really just found the information so awesome and so pertinent and so, cutting edge and fresh. And I really appreciate what you guys are up to.
I love
And I
that.
really appreciate in particular that you seem to know about hands-on bodywork, which I
Mm-hmm.
personally practice
Mm-hmm.
and receive quite a bit of, and it's been a big part of my healing process.
Well, and I
So,
think
and
that's like really significant because how many people with Lyme are just going that antibiotic route and not necessarily thinking about the other parts of the puzzle and the physical body work that they could be doing that could be really complementary. I feel like that's not what people are normally seeking out.
I don't think people are very well educated about how helpful it is. And
Mm-hmm.
I think that's because most doctors aren't aware of how helpful it is. So that I think you're special in that way that you guys talk about bodywork and how it can help
Yeah, of course.
and how
So
powerful it is. Because yeah, it's been enormous for me in terms of being able to heal.
well, I'm so curious, like what type of body work? Because I know that you also have a background in anatomy, which is just so significant when you're doing body work. So tell us a little bit more about the type of body work, your specialty, like, and also things that you feel like have been really good for yourself in the scenario of having Lyme.
Well, let's see. So I've been teaching Pilates for about 20 years, a little
Mm-hmm.
more than 20 years. And before that, I was a modern dancer.
Mm-hmm.
And I got a degree in modern dance, which was heavy on the anatomy back when I was a
Yeah.
baby. And a lot of my friends are massage therapists. I don't know. I just have been in this sort of body community
Mm-hmm.
forever since late high school. So the kind of body work that I practice on my clients, actually what I'm really interested in right now, which I'm doing a lot of because now I have more people with Lyme who are coming to see me, is cranial drainage. I'm really into
Mm.
helping people's lymph and blood and cerebrospinal fluid drain out of their brain. And I'm interested in that because it helps me so much. So that's the kind of body work that I've gravitated to
Mm-hmm.
for my own healing process. And then it's also what I've been super fascinated to learn more about being able to practice myself on my
I
clients.
love that. I really do. That's we actually have two practitioners that do craniosacral
Hmm.
within our office, and I'm sure there might be some similarities and differences between your style, but that has just been so unbelievably significant for the healing process for so many of our clients, especially those dealing with Lyme, neurological Lyme. And I'm so glad you mentioned the lymphatic system because I personally feel like in clinical practice, that is extremely overlooked. And
You know what? I completely agree. I totally agree. And I guess I feel lucky that my background was in anatomy when I got sick
mm-hmm,
because, of course, like everybody else, it took me a few years to get diagnosed.
mm-hmm,
But during that time, I was like, my lymph isn't moving in my
yeah,
brain and my liver is not working. It's just
mm-hmm,
stopped. It's like an inert block. What is
mm-hmm,
going on?
yeah,
So I could feel what wasn't working to a certain degree and I could work on it myself.
mm-hmm.
And that's where the meditations that I wrote came from.
Yes,
But
and
yeah, I
I want
agree.
to
Lymph
dive
is
into that.
huge.
Yeah, the lymph, I feel like the one important thing for people that are going to listen, they're going to be listening because maybe they are dealing with Lyme or, want to understand more, want to know what they can do. And I'm so excited to talk about, the sound therapy and the meditation. But I feel like an important thing for people to understand is that Lyme is not as linear as it's thought to be. There's obviously this infectious agent that we need to help the body eradicate, but it's not always about the killing spree. It is about using these different types of techniques to help the detoxification pathways to work again. And I find that we're going to get so much more success when we have the ability to not just kill it, but actually mobilize it out of the body, because
Absolutely.
those systems are
Otherwise,
so
you can't
important.
heal. If you can't mobilize it out of the body, you can't heal.
Yeah, 100%. It's actually an interesting story. I had a woman who came to see me, and she didn't come to see me for Lyme. She had Lyme. She said that she had Lyme technically 9 years ago, and she was on antibiotics for 7 years. And then finally, at the 7 year mark, they said, "Oh, well, your blood looks pretty good. You feel like crap, but your blood looks okay. So, we'll be done with the antibiotics." And she came to me for a lot of fatigue, brain fog. Like she was literally practically sleeping sitting up.
Mm.
And when we evaluated her, her lymph was the biggest problem. So this was a woman who is on these killing agents for 7 years, and she actually just had a lot of dead Lyme sitting in her lymphatic system. And that was
Mm.
the biggest problem for her brain. So it was just so fascinating to see that, because, this woman just, she had the post Lyme syndrome because she literally never really fixed the foundational problem in the first place.
That makes a lot of sense. Yeah.
Yeah.
I have a Lyme client right now who she tried antibiotics and it just made her vomit all day and all night. And it was because her body wasn't able to clear either the antibiotics or the dead Lyme. So she had to just back off and just start with detox.
Yeah, which is, it's multifaceted. There's a lot of pieces of the puzzle, and it's kind of looking at the body as a whole. And that kind of brings us to the meditation piece, because, when you contacted and I was reading about it, I was so fascinated with this concept of using this meditation therapy, specifically to target some of the most stressed systems when someone's dealing with Lyme. So I'm just going to let you talk more about it, and just kind of give us the rundown of how you came across it, how it's helped you, all the good stuff.
Okay. Um, like I said, before I was diagnosed, I didn't know what was wrong with me. And of course, the regular medical doctors were telling me that I had anxiety, which
Yeah.
was true. I did have anxiety, but I knew that wasn't at the heart
Yeah.
of the problem. So, what I was left with as I searched for a practitioner who could actually figure it out was what I could do on my own. And meditation was the one thing that I could always do that always worked.
Mm-hmm.
And I had been a dancer, Pilates teacher, blah blah blah. I was into running, so I had always handled my stress or mental challenges through physical activity. But
Mm-hmm.
that was taken away from me for a while I was really sick.
Mm-hmm.
But what I could do that still felt very physical was go within and in a meditation and kind of travel through some of these different physiological systems of mine that felt as though they were so compromised,
Mm-hmm.
and just use visualization, use my own brain to using imagery or whatever, mostly just using imagery or sometimes words, language, images, whatever would kind of be a ticket into those systems for me
Mm-hmm.
to get them to start feeling as though they were flowing again. And
Yeah.
it actually worked ridiculously well. I was so surprised. I mean, it worked better than anything else I was doing at the time. So I became a total avid meditator and would spend, 2 to 4 hours a day curled up, sometimes at 3 in the morning when I wasn't able to sleep,
Mm-hmm.
visualizing these systems. And I got super into it. I got kind of obsessed with it. And I started writing them down, recording them on my phone, turning them on. So if I was in a particularly difficult state, I didn't have to come up with the imagery or the words myself in that moment. I could just listen to it pre-recorded.
Mm-hmm.
And that was even better. That started putting me to sleep. And like I had a lot of insomnia. The sleep has probably been one of my biggest challenges with Lyme.
Mm-hmm.
So being able to have the recorded meditations actually got me sleeping 8 to 10 hours a night. And that was huge. I started to
Mm-hmm.
really heal with the better sleep.
Mm-hmm.
And then I wound up discovering that I actually had Lyme disease and started reading about Lyme disease and getting more educated about it. And then I thought, I could put these out there for other people, because Lyme is like, it's not like you figure out you have Lyme and then you get a 2-week course of antibiotics and you're better. It's
Yeah.
years, it's a long
Journey.
process of getting treated. And over the course of those years, you gotta have something you can do with yourself in the days where you're not seeing the doctor, you're not getting a treatment, you don't have somebody who can take care of you or whatever. There's a lot of hours where you're alone with your symptoms. And for me personally, I just found that to be immensely challenging emotionally, mentally, and the meditations helped me. They gave me something that I had that is not expensive, that I could do any time of the day or night. I didn't need an appointment. It wasn't going to cost me $250 like everything else I was doing to treat it.
And I think that's like really huge, because I know there's a lot of people that you are with those symptoms and not a lot of people can relate to the severity of the symptoms. And, sometimes people around you that can't relate almost are like, is it as bad as you say that it is? And, I find that a lot of the Lyme patients that I've worked with, they have been part of these Lyme support groups, which they can be beneficial, but then they can almost create a little bit of an identity of I am a Lyme patient. And it's hard to not identify with that at a certain point. So I think it's amazing that you were able to find a really amazing tool to help yourself in those really hard times.
Yeah, I didn't want to get sucked into the abyss of dwelling on the negative symptoms and dwelling on the fear that they create. And I was also introduced to DNRS, and that I was introduced to that before I knew I had Lyme. Do you know about it?
No, can you tell us more?
Oh, it's this woman, Annie Hopper, wound up with severe chemical sensitivities, so much so that she was living in a houseboat in the middle of nowhere, Canada. So she wasn't around any electricity or any chemicals of any kind. Otherwise, she would have seizures. And she wound up feeling as though, she's a psychologist, and she wound up feeling as though what had happened was during some chemical exposures that she had had to mold and to paint fumes, that her limbic system had been injured by the chemical exposures and then created this sort of haywire trigger response. So now she's worked with people with chemical sensitivities all over the world with great results, where you use a sort of a brain training system to train yourself to tolerate tiny amounts and then larger amounts of chemical exposure.
I love it.
And and some people with Lyme are doing it for food sensitivities, or, I have a friend who's got severe babesia and she's using it for chemical sensitivities induced by babesia. So for me, I thought the meditations were a lot like the DNRS work, except that I didn't have to come up with the juju to create them for myself every time. I could pre-record them, and if I was really low, I could turn them on and they would bring my brain to a place of positivity and, endorphin release and a rush of good feeling without me having to really expend all that much energy. Because DNRS, to practice it, it actually takes a lot of energy for me anyway.
It's interesting. So I wonder if it's similar to some things that we're doing at our office. We don't call it that, but we use a lot of like neurofeedback, and we have a brain entrainment device, and we use it in a lot of different ways. But once the brain becomes compromised, it's very difficult to heal unless you're, understanding how to heal that system, because we all know the brain controls everything, and it's sensitive considering the amount of toxicity that we get exposed to on a regular basis. And also infectious based. There's obviously a lot of infections that can stress that system, and it's a snowball effect that happens over time. So being able to tap in, and everyone's different with what's going to be best, but being able to have some type of healing process for the brain is so significant.
I think so too. And I think it's just natural and normal for the brain to identify a threat and then try to fix the threat. And if it's something like Lyme, you're not going to fix that by obsessing about it, but it's going to be the brain's tendency to obsess,
Of course.
And that's what I just knew. I didn't want to do that. I knew it was unhealthy. I knew it was bringing me down. I could feel my brain wanting to do that. And I knew I had to actively shift in a different direction. Yeah. Otherwise it was going to be harder to heal.
So right now, I know one of the things that I found particularly interesting is talking about how there were certain meditations that you found were really beneficial to certain systems like the vagus nerve, etc. So I was just curious, was this kind of based off of just trial and error? Were you also were there certain frequencies that you were finding were more beneficial for certain things? I'm just so curious how it all came together.
Um, I didn't write the music myself. I worked with a composer and
Mm.
producer. His name's Alex Theory, and it was just a little moment of kismet. We worked together 20 years ago recording music for my dancing way
Mm-hmm.
back, and then we lost touch completely. And then as I was writing, so I wrote the meditations, I wrote the words, and I did the vocals on the tracks, but Alex
Mm-hmm.
did all the music.
Oh, I love it.
Um, and there can't, let's see, so I'm trying to answer all your questions at once.
That's
So
okay.
in terms of the frequencies, that was all Alex. And he's
Okay.
really into meditation. He's written tracks for other meditation
Mm-hmm.
people. And I don't actually even know what frequencies he used. He totally went deep and had a different thing for
Mm-hmm.
each track that had been
Mm-hmm.
harmonized through
Mm-hmm.
music in whatever way. And we worked on it together until it felt right.
I love that.
But I left all the music up to him.
Yeah, I asked that because we just like some of the things that we encompass in our practice is frequency-based therapies, and we do just find that they have tremendous, tremendous benefit. And you can use frequencies in so many different ways. And for those of you that are listening that are like, "What the heck is a frequency?" What it really comes down to is it's almost like bridging the gap between always using chemistry and medicine, which is really supplements, medications, pharmacology, and then taking a step outside of that and using energy, frequencies, vibration, which I personally find as a physician that it works better and faster. so
Yeah.
so I think that it's, you can use the concept in a lot of different ways. And then obviously when it comes to the meditation, so many people are going to benefit from that because it has its, therapeutic undertones, but at the same time, we all need to relax.
Absolutely. If you just relax, even that is just good enough.
Yeah.
But as a body worker with my history with body work, I am again and again overwhelmingly surprised by how much thought affects the deeper systems in the body.
Mm-hmm.
And it's not something that we're taught about. It's not something that anyone knows anything about
Mm-hmm.
unless you are a body worker. But
Mm-hmm.
if you have your hands on somebody's head and you're feeling their lymphatic system, and then they start to imagine their lymphatic system, the
Mm-hmm.
whole thing changes, and it's immediate and powerful. And
Mm-hmm.
to me, it's something that I feel like if I could do one thing with my life, it would be to just bring that out into the world a little bit more, how much power you have in terms of your ability to visualize the interior of your own body and
Yes.
how quickly those systems respond to your thinking. It's super amazing. It blows me away.
It's so interesting. I'm totally blanking on his name right now, but um, someone that is actually in my profession. He's actually been on a ton of podcasts lately because he went through a really, really significant injury, and he was pretty much told like you're going to be a paraplegic, and he shattered parts of his spine, and he used visualization
I know who
to.
this was. Who was
I
that guy? Was
know,
he a
what is his name?
chiropractor?
He is a chiropractor, and I'm literally, I can't believe I'm blanking on his name.
It's not Joe Dispenza, is it?
Yes, 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 yes,
Oh,
Joe
okay, okay,
Dispenza.
okay. Okay.
And it's just so interesting because I've known of Joe Dispenza. I've seen him speak because of when I was in school, and I was seeing how he was just like on a lot of press and media lately. And I was so curious. I'm like, I wonder what his story is. And listening, it was really all about, going through his healing process when pretty much every doctor, every physician was, you're not going to be able to walk, you're not going to be able to function, you're not going to be able to practice. And he was able to use visualization and his mind to completely transform his body.
And go back to work in like 12 weeks.
Yes.
Unbelievable.
Yes. It's just fascinating because, a lot of us, we're just very suppressed. We're very suppressed because we're stressed, we're busy, we have our day to day, and then we're all programmed to think that, medicine and surgery is the only thing that can fix us, and we don't realize the power of our own mind. especially with using, some type of guidance. And I think it's just so important for the work that you do and bringing this, to our audience to understand how powerful getting your mind right is for your healing process.
So true. And it's with Lyme, I mean, I have to say that I was a little frustrated that I couldn't heal myself completely with my mind in a couple of months.
Yes,
I
yes.
felt that I should be able to do that, and I couldn't. I needed a whole bunch of alternative other therapies also.
Yes.
So I don't want to say, I mean, I guess I don't want anyone to feel like there's something wrong with them if they need a whole lot more than
Yeah.
just meditation, visualization, whatever, body work to heal. It's just that it's a wonderful component. It's a very supportive component. And I feel like it'll carry you through the treatment process in a gentler, more comfortable way and help you out the other end stronger.
100%. And I think that it's just, I'm a integrative physician doing all those integrative therapies that you're talking about. But I know that I see plateaus in my patients that are extremely stressed, or they identify with being a Lyme patient, and or they're in a relationship that they're not willing to acknowledge is not working for them. Like, when they have those mental and emotional stressors, those are the only people that I see that don't get better. And it's
Yeah,
because they can do all the therapies in the world, but we all know that when we're stressed, how crappy we feel.
it's so
And
true.
it's just like those little stressors, just even getting cut off by someone, or that nasty email from your boss, like all of those compounding on a day-to-day basis, like all of that is creating a lot of stress internally that's going to prevent us from healing. So having a meditation practice, having, some way to balance your mind, de-stress, whatever that looks like for the person, is an essential component.
Absolutely. Absolutely. I don't think I would have gotten Lyme if I hadn't been very stressed when I was bit by the tick. But
Yeah.
I let myself get into I had two babies, one of which was pretty difficult. And I was running my business full time, and I was just kind of running myself into the ground.
Yeah. And I
Yeah.
always say that with Lyme is, there's a lot of people that have Lyme in their system. And I know that
Yeah.
that was me. And I never had the telltale symptoms by any means, but it takes that one catalyst. It takes that, one emotional trauma, or that, burning yourself out, or whatever the case may be. And it takes that one powerful catalyst. And then all of a sudden you're like, oh my gosh, what is happening to me?
So true. Yeah, you could carry the bugs around for years.
Yeah, exactly. So I
Yeah.
think that's an important thing for people to know is, we don't want to live in fear, and we just want to be able to know that there are strategies out there, and also even for people that don't have Lyme, I'm sure they can benefit tremendously from your meditations.
Absolutely. I'm hoping to reach. Initially, I felt like I just want to talk to people with Lyme because that's what I understand.
Yes.
Now I'm feeling like I'd like to branch out more to the wider chronic illness community. My aunt just died of ALS, and she was using the meditations just to manage her anxiety.
Mhm.
And she chose to commit suicide at a certain
Oh my
point with
gosh.
ALS. But, so in that case, you're not necessarily looking to completely heal
Mhm.
these systems, but you are looking to have some peace and
Mhm.
silence within your body as
Of
you go through your
course.
process day to day.
Of course, of course. And it's just, like we've said already, it's a piece of the puzzle. Everyone's extremely different. Some people might use the meditations and that's what they needed. And then there's other people that maybe need that in conjunction with other things. And
Hmm.
we're all very different. Our needs are very, very different. And I think it's so important to work with a physician who is going to acknowledge that and honor that as well.
Yeah, and see the whole person.
Hmm. Yeah.
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 It's the frontier of medicine. I just think and I congratulate you for being there. I think it was a good time for me to get Lyme just because I feel like functional medicine is so awesome right now, and it's just bursting with creativity.
Yes, yes. And I think that at the end of the day, I feel very fortunate because I actually was in the alternative world to begin with, as a chiropractor. And then
Mm.
I segued into, the functional and integrative medicine and kept learning. But, some of my colleagues that are MDs, I do feel like they feel a little trapped, in the sense that, insurance dictates a lot of what they can do and not do, how much time they can spend. So I think it's just the more people that we reach with this message and understanding that, we need to ask better questions, we need to get outside the box, we need to, do things differently. It's going to allow for more of the physicians to also move in that direction as
I
well.
hope so. I really hope so.
Yeah. There's some that never will, but there are some that I know feel just kind of trapped, honestly.
Mm. I could imagine that if you only have 20 minutes with each person and you can only prescribe through the insurance companies.
Yeah,
Yeah.
exactly. And that's the big, thing is a lot of people want to do functional medicine, but they want everything to be part of the insurance. And I just try to tell people, I'm like, unfortunately, the people that I work with usually have been down that road, but they're still coming to me because they
Yeah.
didn't get better. And I would never be able to do what I do if was trying to follow those guidelines. I can't play detective with my patients if I only get 15 minutes.
No,
Yeah.
you can't.
Yeah.
And you're not going to be able to test for Lyme and co-infections and EBV and HV6 and everything
Yeah.
unless they're willing to pay, which is it's sucks. And I
Yeah.
mean,
I
it
totally get
really
it.
puts a ceiling on healing. But
Yeah.
yeah, hopefully that'll change in the next 10 years, maybe.
Yeah. Well, I think that's, one of the things that I got really excited about over the past year was trying to actually use a lot of really customized technologies that came from Russia and Germany because I was trying to keep the costs down for people. I get the Lyme world. I work with a lot of Lyme patients, and I think IGeneX is what, $1,200 just to figure out if you actually have Lyme or not. And then
It's a lot.
yeah, and I don't even think that includes the co-infections.
No, it doesn't. Each one is a
So
separate test. Yeah.
yeah, so then you're a couple $1,000s in the hole, and you're like, but now I need to get better. So now, like, what do I do
Yeah.
now? So I totally get that, and I've actually worked really hard to try to see how we can do our diagnostic process, in a fraction of the cost, because I'm like, that's great. I want to give you clarity because I know that's part of the healing process is just actually knowing what is going on with you, but I want you to actually get better too.
Yeah.
Yeah.
Seriously.
Yeah. So why don't you tell everyone where they can find these amazing meditations?
My website is redkitemeditations.com.
Awesome.
And the meditations are there. They're also on iTunes.
Okay.
The album is called The Cell's Breath. And if you Google the album, or whatever, not Google, but if you go on iTunes and search the album name or my name, Shona Curley, the album will come up.
Awesome. I love
Yeah.
this. I have to go explore my own meditation. I always say I'm terrible at meditating. I haven't properly given it a good enough go. But I love what you're doing because it's literally just pop the headphones in and chill.
I have a really hard time meditating too. That was always why I did movement or went running.
Yes, I get it. I get it.
Yeah,
So
but if you give your brain a train to follow,
mhm,
then you can go deep and really deeply relax. And to me, that counts as meditation. It may not
of
be
course.
just following your breath and noticing the thoughts that arise, but you're still very present in your own body. And for me, that's enough.
So a couple of logistics for people because I know for me, I can even like classify myself as like meditation for dummies. So when it comes to the meditation for people to get great results, or just to get started, is if you're dealing with a chronic condition like Lyme, what should be an amount of time that they should do it for to start really noticing the results? Is there an amount of time they should cap out at? And then, in addition to that, should they do the meditation just relaxing, or can they do it while they take a walk or run?
I think you can completely customize it to your own body. I have a
Mm-hmm.
good friend who's got severe neurolyme right now, and she puts on headphones, puts on an eye mask, closes all the curtains, and listens to the whole album sometimes twice through. So that's like
Mm-hmm.
4 hours of lying there in the dark listening to the album because she says her brain gets so overwhelmed that she just has to tune everything out except for something that she can follow that's healing, you know? So that's extreme. I never use them to that degree, but she
Okay.
does. She says she does that almost every day at the moment.
Okay.
And that's working for her. So I don't think you can cap out. You can do whatever you want.
Okay. Okay.
For me, when I was really sick, I used them maybe twice a day. They're each meditation. I think there's 6
Mhm.
meditations on the album and then one 5 minute. Like most of the meditations are about 20 minutes, and then there's
Mhm.
one that's only 5 minutes. And that
Mhm.
one's actually free on the website also,
Mhm.
on the homepage, but then it
Awesome.
comes with the whole album if you buy the whole thing.
Great.
Or you can buy them by track on the website too if you're like, I just want to deal with my lymph. That's it. Or I just
Got
want to
it.
deal with anxiety relief and the vagus nerve.
Mhm.
So what I did when I was using them is I would listen to 1 or 2 a day. I usually would get really into one for a bit and listen
Mhm.
to it once or twice a day for a week, 2 weeks, until that system started to feel like it was calming and I didn't need it anymore.
Mhm.
And then as I got better, but I still felt those systems flary here and there, or just inert, like the liver detox was for me. I needed fire. It needed life. It was
Yeah.
just overwhelmed. So the more fiery meditations, like the liver detox, it uses a lot of kind of fiery imagery to get
Mhm.
heat into the liver and movement into the liver.
Mhm.
I would use those while taking an Epsom salt bath, or while hanging around in the infrared sauna, or even while getting an IV therapy or taking a
Mhm.
walk.
I love
So I
that.
think you can play. There's no
Yeah.
right way or wrong way.
I love that. I love that. I think that's really great because that's a principle that we encompass a lot is I always say it's not about what you do, it's about how you do it. And it's really just about making sure that if you are supporting or working on a detox pathway, making sure that it's like supported start to finish. So if you are going to listen to that, liver detox meditation or lymph meditation, doing that in an infrared sauna, you probably get double the benefit.
You probably
So,
would. Yeah.
yeah. So I love that and being able to be strategic about the utilization of those meditations.
Yeah. And I mean, I'm big into the body's intuition too. I feel like your body will tell you what you need. You just
Hmm.
listen. If you feel better, it's working. If you feel worse, mess with it and try something different.
I love it. I love it. And I'm going to assume, but the meditations are all available digitally. And then, do you also have a like disc option for anybody who even use those? Use
No.
okay, okay. I just wanted to clarify. It's so funny.
Yeah.
Everyone thinks I'm so young, but I'm a little bit old school.
Really?
Yeah, totally. I definitely still have like DVDs and CDs.
Yeah.
So
I gave them all
funny.
away.
Oh, I love it.
Yeah,
No,
I
and
didn't want.
it's a digital world, so it's so much easier for
Sure.
everyone.
Yeah, yeah. So they're just digital files.
I love it. So, is there anything else that we should know about with these like meditations, like any just amazing, stories with it or other populations that you feel like can benefit? I'm sure it can benefit everyone, but anything else that we should know?
Sure. Well, so the types of people that I have heard from who are listening to them, besides people with Lyme, are migraines. There's a
Mhm.
cranial meditation in there
Mhm.
that is a lot about light in the eyes. Do you know what the Bates method is of healing vision through
Mhm.
relaxing the eyes?
Yes.
So the Bates method apparently came from an ancient Buddhist technique of
Mhm.
visualizing perfect blackness. And
Okay.
there's something
I didn't know.
I don't understand the science about it exactly, but there's something about perfect blackness that really releases and softens the optic nerve.
Mhm.
And that can help with migraines, that release around the optic nerve. So the cranial
Mhm.
meditation, my brother has severe recurrent migraines and he uses it. And I've had a
Mhm.
number of other people email and write me saying that it's helping
Mhm.
with their migraines and that they can use the imagery even if they're not listening to the meditation after a while to get through or lessen the severity of a migraine.
I love it.
And people with breast implant illness or heavy metal toxicity
Mhm.
are definitely using the lymphatic meditation, the
Mhm.
liver and kidney flow meditation.
Great. Great. I love
Yeah.
that.
And even just people with anxiety with who knows why, the limbic system anxiety relief meditation is good across the boards for
Mhm.
people with anxiety.
That's so great. And
Yeah.
just for those of you listening that are like, what's a lymphatic system or like, what does that mean? Why is it important? Is I would say the biggest common theme that I see in clinical practice is that a lot of our lymphatic system is overloaded. And it's partly just due to an overload of toxins we're exposed to from the air, the water, our food, pesticides, herbicides, GMOs, etc. So with that being said, regardless of where your health is at, it's probably really beneficial for you to utilize, these lymphatic or even liver meditations.
It's true. We just have our detox pathways have a big job, even if you don't have Lyme.
Exactly.
They're
Yeah.
working hard in this
They're working real
modern
hard.
world.
That's for sure. Especially living here in lovely, polluted New Jersey. So,
Oh,
so that's the thing is like for me, I'm always maintaining my lymphatic system. I have an infrared sauna in my house. It's
yum.
just, it's just like a necessity at this point.
Mm.
But I love everything that you're doing. And just to reiterate, Red Kite Meditations is where you can find these amazing tracks, and I'm really excited about trying it out myself.
Oh, yay. Thank you. I'll say one more thing that I
Yeah.
thought was really, really cool. There's a couple of people have told me that they've listened to the meditations with their kids, if
Uh-huh.
their kids are immune compromised in some way or have some kind of struggle physically.
Yeah.
And the last person I talked to about it said that, it's difficult for a kid to put on headphones and actually focus. They get kind of jumpy. But
Yeah.
so she would have a video of just ocean waves
Hmm.
that her kid could watch as he listened to the meditation, and that really worked for him. He dropped into the
I
visuals
love it.
if he had something to watch as well. So that just makes me super happy, because the thing that just breaks my heart the most is kids getting Lyme. I mean, or
Yeah.
any
Hmm.
illness. It's
Yeah.
scary and horrible. And I mean, for me, I felt like as an adult, I could tackle it and be like, okay, I don't eat any sugar. I don't eat any carbohydrates. Like, I'm
Yeah.
starving these bacteria. But if it was one of my own children, I know how much they would struggle with completely changing their diet. I know how much they would struggle with drinking the herbs that taste so intense,
Yeah.
you know?
Yeah. No, I
But
know. And that's the thing is it's just there's a lot of things working against us, and yeah, there is a large population of younger adults and children that are getting sick, and having as many tools as possible is just so important. So,
yeah,
and especially things that are accessible to kids. So I love that the meditation could be something that they could do to calm down their nervous system and
yeah,
just better their bodies.
yeah. And learn about their physiology at the same time, kind of. I mean, the meditations are not sciency at all. They're very
Yeah.
poetic rather than scientific, but still you kind of learn what your lymph is just by listening.
Exactly. I know that's the thing is it's teaching kids about, physiology, teaching them about food. These are things that unfortunately kids have no idea about anymore.
Oh my God, it's work for parents.
Oh, I'm sure. I don't have
Yeah.
kids, so I have dogs and they're enough work. So I can't even imagine. I commend you. That's for
Thank
sure.
you. Yeah. I'm glad I'm the one that got Lyme, knock on wood, and not my kids. I feel like it would
Yeah.
have been much harder actually for me if one of my kids had gotten it.
Oh, it's very emotionally trying. I see it all the time, and
Yeah.
that's just one of the things I always try to explain is just, we got this. We're going to take care of it. Just, be calm, because the last thing you want is, the household to be under tremendous stress, because we all know that's not good for a healing process.
So true.
Yeah.
Yeah.
So, well, thank you so much for being
Thank
here.
you.
Much appreciated. I love the work that you're doing, and it is so necessary and so needed. And I think it's really important for people to have an at home tool that they can do on their own and they could use any time of the day, they can use any time of the night. And, it's so much better than grabbing for, you know, Xanax or something else, that's going to obviously give us a lot of side effects. I think it's so great that this tool is available.
Thank you so much. Yeah. And I look forward to continuing to follow your work as well.
Well, thank you so much. And I hope everyone enjoyed Red Kite Meditations. Everyone check it out. And then she has a little sample on her homepage so you can experience what it's all about.
Yay.
All right. Bye, everyone.
Bye.